We're very glad that you were able to join us for another one of our roundtable programs discussing Addison's response to the COVID-19 pandemic. It's been just about 1 month now since we began our series, and we're back once again to continue on our conversation, find out how the community has been complying with some of these various requests and regulations that have been handed down from higher up authorities, but also making sure that the community is staying safe. Joining me once again is Addison's Mayor Rich Veenstra, and from the Addison Police Department, Deputy Chief of Police Joe Maranowicz. So gentlemen, thanks very much. It's becoming a common occurrence here, a common exercise that we're doing here. Mayor, you study these facts and figures pretty closely. I know that both of you are on various conference calls every day. Can you give us a snapshot as to how is Addison doing when it comes to things like compliance, keeping the social distance regulations in place, even so far as to wear masks and so on, things that have been recommended by higher governmental authorities?
You know, that's, I think, one of the biggest issues is that there are so many opinions out there and so many suggestions, and understanding really what is being recommended by CDC, what is actually something that we're basically recommending to our residents gets very confused. And people are well-intended, but sometimes misinformed. And one of the things that we've been looking at very closely are the numbers that are being released from the county, showing the number of active cases being reported. And as we've been looking at these numbers, they change on a daily basis, but we're really starting to question where they're coming from, how they're being counted, and whether they really are accurate reflections of what's going on in the communities. And one of the things that we're concerned about is that the number of deaths in each community have not been reported. So while we realize that the incidence of COVID is everywhere and very prevalent, the numbers seem to indicate that probably 80% of people who have the virus really don't have symptoms. So the numbers that are being reported are low. We anticipate as testing becomes more prevalent, those numbers are going to go up. People are going to panic, but the reality is that infection is already in the community. So trying to really distill how impactful the disease is on our community is a very, very important thing for us. Getting the right information to really know and get a good handle on it has been very difficult. So we're working with the county. We've asked some specific questions as to the origin. We have several emergent care centers in town. Are the incidents of the virus being reported because they're diagnosed at that site, irregardless of where that patient lives? They could be out of town, but being reported as Addison events.
Oh, they could be a resident of another community.
Possibly.
Right?
It's a really good point, too, because we're getting some complaints as well from concerned residents saying, well, this business might have an employee that tested positive. And you contact the business owners, and the business owners are really doing a good job. They're taking the proactive measures that they need to take. And if they do, unfortunately, have an employee that gets sick, they're actually reporting that to the DuPage County Health Department.
Which is a good, responsible thing to do.
Yeah, and they're doing everything what they are supposed to do. But how is that being reported? Is that an Addison case, or is that a resident that lives in another town? Is it being double booked, as we'll say, in two places? Okay. So there's a lot of interesting questions that come up with the numbers.
So who's the official authority on something like that then?
Well, the county and the health department are reporting them, but questions, we found out that unincorporated areas in Addison are being reported as Addison. Okay, so when they see the statistics, we have a fairly large number of residences in our geographic area that are not technically Addison. So when we look at the population numbers, those homes aren't counted in our population, but occurrences of the virus are counted.
Makes the percentage
so it makes the percentage go higher. You know, right now we're at about 0.3% incidence based on population, which is not that significant. Again, we want to know what the death rates are to see if that 3% or 0.3% really translates into a significant number. And is there a real variation from what happens on a year-to-year basis with the flu? And how serious, we know it's serious, but what extent are we looking at, and how serious are the precautions that are being taken to minimize it?
Are people getting a little lax when it comes to precautions? I mean, are they starting to tire from this a little bit, or are they ramping up and going just the opposite direction?
I think residents are doing a really good job. You're seeing people take the proactive measures, right? We are seeing social distancing. We're not seeing large gatherings at parks. Now, when the weather breaks, you might see that. It's raining out today. We probably won't see a lot of activity. But traffic-wise on Lake Street, you're seeing people starting to come up. It's picking up. It's picking up everywhere. But I think overall, residents are doing good. Sure, we're going to get some complaints that come in, but also something to keep in mind. Addison's pretty unique, right? We have a large industrial area, which comes with that a lot of essential businesses that are still working. People are grateful to have jobs. People are grateful to come to work. And when they come to work, getting back to that point, how are those numbers being reported? We have a lot of influx of a large population. Our daytime population in Addison skyrockets due to the business. So hence you might be able to see some of that population, that traffic on Lake Street, on Fullerton, on your side roads, because are they going to work? So you're going to see a lot of it.
Is there a problem with gatherings still? Or we talked about the last time that both of you were here, we talked about the issue of social distancing, but also large gatherings taking place even in a private residence. Is that still a problem? Are you still seeing that, Mayor?
We saw a high number during the Easter holiday 2 weeks ago for traditional Easter. For the Orthodox Easter this last Sunday, there was a small spike also. So I think for those holidays, yeah, there was an increase. Whether or not that really is impactful is a good question. Yeah.
And the mayor's been big on with that message about social distancing, and we're coming up to 2 more big events. Mother's Day, if people elect to get with their moms, or depending on how their health is, and also graduations. We know, I don't want to speak for the school districts and how that's all going to go, but will families celebrate in some type on both of those events? That's why we stress.
Those 2 events, and then the 2 Easter holidays that you just talked about, Mayor, it was very difficult to tell people not to go about their traditional familiar gathering, whatever that might be. It would be very difficult to handle that.
And I know it's very hard. I mean, there are a significant number of residents that are really very, very fastidious in looking at the social distancing. My grandkids live next door to us, and we haven't come within 6 feet of them in the last 4 weeks. They knock on the door, leave something in the front, and disappear. Yeah. So people have been working very hard, and when they see somebody that they perceive as just ignoring, they are rightly concerned, because we're working hard to protect ourselves and they don't care.
Will that trigger an enforcement issue, though?
We will, and actually a letter went out today to the businesses that we have chosen to rely on the goodwill of the businesses to enforce. But as we start getting reports of violations, we will take action.
What about masks and the wearing of masks? Some communities have gone so far as to put in a regulation to that effect, that a mask of some covering needs to be worn upon a person's face when they're out in any public area. Are we at that point yet here?
We have not. We're expecting the governor to come out with a ruling. Next couple of days, he's probably going to extend. We're expecting the stay-at-home, but with some modifications, and that might come with the requirement to wear masks in certain situations. We've not done that for multiple reasons. First is that the communities that have done it each have their own criteria, which leads to confusion with the public as far as should I, shouldn't I, will I, won't I. We were waiting to see what the governor wants to do, so it's a universal directive. The other issue is supply. How will masks be supplied to? We've got 37,000 people in our community. Are we going to supply masks to them? Are the businesses going to? Are they going to? Where are they going to get them? So the pragmatic effect of how do you go about enforcing and making sure everybody has a supply is more problematic than just keeping the 6 foot distance.
Yeah. So you're not going to send police officers out to be checking for masks and 6 foot distance and so on?
To that point, We get the complaints, and sometimes you say, hey, there's kids walking down the road. Well, that might be a large family of 3 brothers and a sister, and they're walking. Well, they can do it. I know how it looks, and it might look bad that, oh, there's friends getting together, but they're actually family members. So what we strive for is education. We'll go, we'll investigate, and then we educate. Some people don't know, but what the mayor was saying, not everyone has a mask. And to mandate that you have to wear a mask, and you've seen that change from 3 weeks to what they wanted to what it is now. It's
when to wear it, when not to wear it.
It's not good. It's this. It's that. Now a bandana is acceptable. So it's always changing. But you look within this community. You look what businesses have done. They've been very proactive in having social distancing within lines before you can even get into the business. We have multiple ones that are doing that. So I think we're doing a pretty good job.
I was going to ask you to comment, but I don't know if you were aware of this or not, because this just came in prior to our recording of this interview. Republic Waste Services, our refuse hauler in Addison, has announced that they will be reinstating the collection of bulk items starting on Monday, April 27th.
Yeah.
So
what's that date again? You want to put that out?
Monday, April 27th. So this is really important for our residents to understand now. And this comes to us from the Addison Public Works Department, that Republic Services has been able to keep up with all of their other services in the past few weeks. So good job there. And as a result, they will reinstate collection of what are called bulk items. And that will be starting on Monday, April 27th. So many people have called to ask about that in the last few weeks, and the things continue to sit and so on. Now they're going to be collected on your regular refuse collection.
And we knew that was going to be a little bit of a bump in the road. We knew it was going to be temporary, so it's good that they're bringing it back. Right. We did put that out on social media. We put it through our communication pieces, and now we're trying to do it again here. It's Monday, April 27th.
You heard it now. So anything else, Mayor, before we close for our discussion?
You know, I think the best defense against the virus is personal responsibility. And that's what we have continued to ask our residents. Be smart, do the right thing, and watch out for your family, and we'll get through this.
Okay. Joe?
He said it best.
Right. There you go. You have it all. All right. Well, thank you very much, Mayor Veenstra, Joe Maranowicz, for being with us. And remember that we are just now announcing that Republic Services, the refuse hauler for the Village of Addison, will begin to reinstate the collection of bulk items at curbside, and that will begin on Monday, April 27th. So you can continue and resume that practice insofar you need that, starting on Monday, April 27th. Keep up with official news from the Village of Addison by visiting our website, which is addisonadvantage.org. And from that website, you can connect with all of our social media platforms, Facebook, the Addison Police Department, Twitter, the YouTube channel, so you can watch some of our past segments as well. If you're interested in learning more about the Addison Township Food Pantry and perhaps making a donation of items that they may be in need of, you can go to atcares.org. That's atcares.org. And if you'd like to follow the dashboard and interactive map from the DuPage County Health Department, their website address is dupagehealth.org. Thank you very much to our guests, and we will see you on our next program. I'm Don Weiss. Thank you for joining us.
Thank you, Don.
You're very welcome. Thank you for coming.